Is your baby's poop color really normal? Or is it the first warning sign of a health problem? And because poop color can change at any time, every parent must know these 7 colors. Number 1. Green color. The moment the diaper opens and green color shows, the heart skips a beat for a second. The mind immediately asks, what caused this color? And is it something to worry about? So what actually happens? When the baby's milk, whether breast milk or formula, moves through the stomach very quickly, the bile produced by the liver doesn't get the full chance to show its normal yellow-brown color, and as a result, the poop looks green. Many times, the amount of green vegetables in the mother's diet, or an iron supplement given to the baby, also becomes the reason for this. HealthyChildren.org, which is a trusted platform of the American Academy of Pediatrics, clearly states that green or foamy poop often comes when the baby is getting more foremilk and less hindmilk. If your baby is playing normally, gaining weight properly, and there are no other symptoms, then just observe the color for a day or two. So in clear words, green color is mostly considered completely normal in most cases. Number 2. Red color. Seeing red color makes any parent's heart stop for a moment. The question that comes up is this really blood or some other reason? If the baby has recently consumed beetroot or something red in color, the poop color can turn red just like that, without any concerning reason. The difficulty arises when nothing like that was eaten, and yet red streaks or spots are seen. In such cases, this could be actual blood, sometimes due to a small anal fissure, meaning a slight tear in the skin during bowel movement, and sometimes it can point toward a bigger cause, like milk protein allergy or an intestinal issue. Mayo Clinic states very clearly, never take a let's see what happens approach with blood seen in poop. It should always be checked by a doctor, even if the reason later turns out to be minor. So next time, if red color appears, take a photo immediately. If possible, keep a sample safe too, and talk to the doctor the same day. Number 3. Yellow, mustard-like color. This is the most commonly seen color in breastfed babies, and every parent has the same question in mind. Is the seed-like texture a sign of some problem? Yellow poop with a mustard seed-like texture, in which small grains are clearly visible, this is a very common sight in breastfed babies. Both WHO and AAP consider this a sign of healthy digestion, meaning the baby's gut is digesting the milk exactly right. Yet almost every parent makes one small mistake, getting scared upon seeing those grainy particles, thinking something strange is happening. Whereas in reality, this is a completely normal part of digestion. So if the color is yellow, the baby is feeding properly, sleeping well, and gaining weight properly, then rest assured. Yellow mustard color is considered medically completely normal. There is nothing to worry about in this. Number 4. Black color, after newborn stage. The most important thing to understand here is this. When it happened matters even more than the color itself. The initial poop that comes in the first 2 to 3 days of the baby's life is called meconium, and it is naturally dark green-black in color. This is completely normal. There is absolutely no need to be afraid of this. But if this same black color suddenly returns 4 to 5 days later, or at any older age, and along with it there is also a tar-like, sticky texture, then this is a different story. This can be a sign of digested blood, which points towards some problem in the upper digestive tract. Both NHS and Mayo Clinic place this kind of black, sticky stool in the list where it says, seek medical help immediately. Just note the timing. Black color in the first 2 to 3 days is normal, but if it appears after that with a tar-like texture, contact a doctor immediately. So here, the answer depends on timing. Normal in the early days, but if it appears later, it is a warning sign. Definitely show the doctor.
Number 5. Brown or tan color. Brown or tan color is often seen, especially in formula-fed babies, and parents have the question of whether this color points towards some problem. Formula digests a bit differently than breast milk, so these babies' poop is often a little thicker and of a brown-tan shade. HealthyChildren.org makes this completely clear. Tan, yellow-brown, or light brown color falls completely within the healthy range for formula-fed babies. A common mistake happens here too. Parents compare their breastfed baby's color and assume that the formula-fed baby's poop has something wrong with it.
Whereas the truth is that both have different digestion methods, so the color will be different too. This is normal. If your baby is on formula, the poop is brown tan and a bit thick, but the baby is comfortable, without much gas or crying, then rest assured. That means brown tan color falls completely within the normal range for formula-fed babies. Number 6. Orange color. Orange-colored poop also confuses parents a bit, and the same question arises again. Is this the effect of diet or something else? This color is often linked to diet. If the baby, at a slightly older age, has eaten carrots, sweet potatoes, or orange-colored fruits, the poop color can also take on that shade. In younger babies, a light orange shade can also appear due to the normal breakdown process of bile. This is a completely natural variation between yellow and brown. If, along with orange color, the baby feels normal, with no pain or discomfort, then it is just the effect of diet. So orange color is also considered a normal variation. No need to worry. Before knowing number 7, make sure to comment your baby's cute name. Number 7. White, pale, or clay-like color. If your baby's poop looks white, light yellow, or clay-like, parents have the question, is this also just a variation like the other colors? Actually, this can point toward a serious sign related to the liver and bile duct. Its medical name is biliary atresia, meaning the bile ducts, which carry bile from the liver to the intestine, are not working properly. Both Mayo Clinic and NHS are completely clear on this point that pale or chalk-like white stool is never considered normal in a newborn. Just think, has your baby's poop ever been this color, and did you leave it thinking, it's just a different shade? If yes, now is the right time to pay attention. If the poop looks white or very pale even once or twice, take a photo immediately and show it to the pediatrician. This is not a color to wait on. The sooner the diagnosis, the easier the treatment will be. So in clear words, white or clay-like color is never normal. It should always be checked by a doctor immediately. So now, let's sum everything up at once. Green, yellow mustard, brown tan, and orange. All 4 of these mostly fall within the healthy range. There is no need to be scared of these. But there are 3 things that should never be ignored. First, red color or any visible blood in the poop. Second, black and sticky poop that appears after the first 2 to 3 day meconium phase. And third, the most commonly overlooked, white or clay-like pale color, which can point toward a serious sign related to the liver and bile duct. If any of these signs appear in your baby, don't delay. Contact the pediatrician immediately. These are absolutely not signs to wait on. Finally, just remember this. Every poop of your baby is a small health update. You just need to know how to read it. If this video was helpful to you, please like it, share your experience in the comments, and don't forget to subscribe for more useful parenting information like this.